Hi everyone, Linet Onyangwa again. Today I will wish to discuss and demonstrate hand hygiene, steps, practices, and strategies, since it is the best way to prevent infection and even control infections. So, enhancing compliance with hand hygiene practices I usually equate to strategies for a healthier world. That means that if we practice very well hand hygiene, then the world will be very healthy. I'll start by saying that hand hygiene is one of the most important ways to prevent the spread of infections, and hand hygiene can help prevent the spread of infections, including things like common cold, cough, and other respiratory tract infections, and even the gastrointestinal tract infections. The challenges for hand hygiene include the need for more educations and awareness, creation of awareness, as well as better access to soap and water. The strategies for a healthier world include more research into the effectiveness of hand hygiene, as well as more education and awareness. I still repeat that. We have importance of hand hygiene in healthcare and everyday life. That means that not only people who work within the healthcare system or healthcare setup that are supposed to observe hand hygiene. This one we are supposed to observe worldwide, everyone. So hand hygiene is a paramount importance in both healthcare settings and everyday life due to its significant role in preventing the spread of infectious diseases and maintaining personal health associated infections. And it's important to note that healthcare facilities, healthcare workers, hands are a common vector for transmitting pathogens from one patient to another. But if proper hand hygiene is practiced, then it can prevent the spread of these infections, especially infections that are related to gastrointestinal conditions and respiratory illnesses. This is specifically important during outbreaks and pandemics. We have healthcare associated infections. And what are these healthcare associated infections? Healthcare associated infections are infections that patients usually acquire while receiving medical care, and they can have severe consequences. Proper hand hygiene by healthcare workers, I will say, significantly reduces the risk of transmitting infections to our vulnerable patients. And I will also say that healthcare workers who maintain good hand hygiene protect their patients from this potential harm and demonstrate their commitment to patient safety. We also have overuse and misuse of antibiotics are major contributors to antimicrobial resistance. Remember, if you use too much of these antibiotics because of the infections that are caused by contaminated hands, then you will overuse the antibiotics. As a result, you develop resistance to these antibiotics. So effective hand hygiene, I'll say, reduces the need for antibiotics by preventing infections in the first place. But we also need to note that in both healthcare and everyday life, hand hygiene prevents cross-contaminations from contaminated surfaces, objects, or individuals to clean ones. So good hand hygiene contributes to personal health and well-being. I'll say that individuals who wash their hands are less likely to become sick, leading to better overall quality of life. And then we also have our infants, we have our elderly, and individuals with weakened immune systems are more susceptible to infections, because remember, it's these immunes that help us to fight fight out the infection. So if they are already weakened, and you also want to add other infections that you can prevent through hand washing, then that will not be right for you and right for me at the same time. So practicing hand hygiene is essential to protect these vulnerable populations. And healthcare facilities must adhere to strict hand hygiene protocols and regulatory standard procedures to maintain accreditation and ensure patient safety. Effective hand hygiene practices reduce healthcare costs by preventing infections that may require costly medical treatments, hospitalizations, and extended period of stay in the hospitals. So these are things that we can actually prevent if we practice safe hand hygiene. It's important to note that hand hygiene is not limited to healthcare settings. So if I'm talking about hand hygiene, I don't mean that it's only confined to people who work in the hospital setups. It's equally vital in daily life to prevent the spread of illnesses within the community, particularly in a densely populated areas where disease can easily cross borders. Promoting hand hygiene globally contributes to global health security by reducing the potential for disease outbreaks and pandemics. Some of the importance of hand hygiene: one is personal hygiene, yourself, personal hygiene, or environmental hygiene. Remember, if we take care of your hands and then you take care of the environment, then where will we get these infections from? Then avoidance of the spread of infections to others as well as yours. And then proper hand hygiene involves two primary methods. We have hand washing with soap and water. I'll demonstrate that physically, and actually as I speak, I think the video is running and you can see what I'm doing. I've started with hand washing with soap and water, and I've ended with using the hand sanitizer. So hand washing with soap and water, hand washing is the gold standard. Mark that, hand washing is the gold standard for effective hand hygiene. Hand washing is essential after using the restroom, before eating, after touching potentially contaminated surfaces or objects, and when hands are visibly dirty. It involves the following steps. How are you supposed to conduct hand washing? How are you supposed to wash your hands? First, wet your hands with clean running water. It can be warm or cold. So I've said you wet your hands with clean running water, and this water can be warm or it can be cold. I haven't said hot. It can be warm or it can be cold. 2, apply soap and lather your hands thoroughly, including the backs of your hands, between your fingers and your nails. Then scrub your hands for at least 20 seconds, about the time it takes to sing happy birthday to you twice. That means that if you sing happy birthday to you, happy birthday to you, that's just enough. I don't know how to sing, I've just tried that to ensure you remove all dirt and pathogens. Then rinse your hands well under running water. Then dry your hands using a clean towel or air dry them. And lastly, using the hand sanitizer. So in using hand sanitizer, hand sanitizers are alcohol-based or alcohol-free products designed to kill or reduce the number of pathogens on your hands or on my hands. So hand sanitizers are convenient when soap and water are not readily available. Remember, hand sanitizer does not replace hand washing with soap and water, but they are less effective than hand washing, especially when hands are visibly dirty. To use hand sanitizer effectively, apply a sufficient amount to the palm of your hand. Then rub your hands together, covering all surfaces until the sanitizer dries off. This typically takes about 20 seconds. Hand sanitizers should contain at least 60% of alcohol to be effective. Categories of hand hygiene: we have hand hygiene can be categorized into several types, like routine hand washing that I've just discussed, and we also we have surgical hand scrubbing. That one mostly is done by the surgeons in the theater, and then hand sanitizing. So kindly watch the video. It is there for hand washing using water and soap, and sanitizing, so that we prevent infections and we control them very well, so that we don't develop resistance to antibiotics. Because if our hands are dirty, that means that we will have recurrent infections, and that means that we will overuse the antibiotics, and as a result we become resistant. And when we get to be resistant, that means that we have fewer options to treat ourselves. Bye for now. Watch it keenly, and subscribe to my YouTube channel. My YouTube channel is Dr. Lynette Onyango. Like the page so that you can be getting updates each and every time. Bye and thank you.